Hello, everyone. My name is Shayla Stewart. I'm with AIDPH, and we're just going to give everyone a few moments to kind of come in the room and get settled. So we'll just give everyone a few moments. Alrighty, so thank you for coming today. We are partnering, AIDPH is partnering with the Nebraska Rural Health Association to bring this programming to you today, the Veteran Oral Health Virtual Road Tour in Nebraska. Just a quick overview. We definitely want this to be an interactive discussion, so feel free to pop any comments or questions in the chat. We do have AIDPH staff on hand to read those, and they will come off mute and let me know. We want this to be as interactive as possible so that we can collect all data so we can add to our summary in the future. A few housekeeping tips. This session is recorded, so please stay muted. If you want to come off mute to ask a question or make a statement, that is totally fine. But besides that, please stay on mute. Slides, forms, and materials will all be available on the AIDPH website after the session. So if you don't capture that during the session, don't panic. We will have that available after. And if you want to, please type your email and organization in the chat. And then if there's any questions about Zoom, my coworker Rahel is in the meeting, and you can just direct message her and she can help you troubleshoot any issues. Today, we will be using the Slido platform to communicate and take some polls and some surveys. So if you want to grab your phone and just scan that code on the screen, it will take you directly to the website. Rahel is also going to pop in the link with the code so that you can also access it via the link in the chat. And these are our learning objectives for today that are tied to our CEUs and encompass what we are learning. They are also available in the registration for today's session, and we will pop those in the chat for your reference as well. Okay, so let's get warmed up with Slido. Just toggle over to that website. We'll pop in the chat for you again, the link if it didn't open before, just let Rahel know. And we just wanted to know what brought you to today's session. And I'll give everyone a few minutes to bring that up and answer that. It looks like we have a few more participants answering, so I will give just a moment to capture that. Okay, it looks like we're about 50-50, all of the above, which is great, and also to learn. So that's wonderful. We are going to keep this live until our next Slido poll, so feel free to keep answering the questions as we move on. And just a disclosure, I'm your presenter today, and I do not have any conflicts of interest. I will be your host. My name is Shayla Stewart. I am an education and leadership specialist with AIDPH. I have been a registered dental hygienist since 2007, and I am finishing up my master in policy and administration in December. With us today, we also have our organizational administrator, Rahel Michael. Feel free to ask anything in the chat, and she will be happy to assist you. We also want to give a big thank you to Carly, the Chief Operating Officer of the Nebraska Rural Health Association, and also Joey Enright for connecting us to NRHA. That way we could connect and bring this session to you and the programming so that we can have a discussion on veteran oral health in Nebraska.
Hey, Shayla.
Yes.
Just really quickly, could you please toggle over to the slides tab?
Oh,
Right now, we just see the Slido page.
thank you so much, Rahel. I appreciate that.
No
Just going
problem.
to pop
Thank
back
you.
over just to give, I gave the introduction, but these are our hosts here. So, all righty, we'll go. And we are going to go back to Slido again. As we're getting started, we want to know, what do you believe are the top priority areas for veteran oral health in your state? So if you just want to toggle back over or pull it up on your phone and just answer that in the poll. And we're just going to give people a few minutes to hop over and answer that. Rahel, are you able to pop that Slido link back in the chat? That might be an easier access than the QR code. Just would like to get a few more responses there. Okay, well, I'm going to go ahead and move on, but feel free. We are going to keep this poll open. So if you want to go over, please feel free to keep answering the poll in Slido. That just allows us to capture data so that we can add this to the VRT summary report at the end of the session. Alrighty, so a little bit about AIDPH. We are a 501c3 nonprofit organization. Our mission is empowering our community to advance oral health through science, education, and advocacy, which we hope will all come together for you in today's session. And we have a vision of a justice-oriented oral health system.
Hey, Shayla, I'm so sorry. It seems like there's technical difficulties. For some reason, you are muted, and also, again, we're not seeing the same presentation slide tab as you.
Is that better, Rahel?
Yeah,
Okay.
we can see the slides now, and we can hear you as well.
Perfect. For some reason, I think whenever I am toggling back and forth between Slido, it's resetting some of my settings in Zoom. So just please feel free to hop on and let me know if I'm not catching that. And then just some facts. We are understanding, of course, that there is intersectionality on these 4 communities of focus that we just discussed. Approximately 30% of veterans report having a disability. Approximately 25% of veterans live in a rural area, something that we'll talk more about today as we dive into the data later. And all have the common experience of historical exclusion and marginalization from healthcare systems. And we just wanted to take a moment to say thank you to CareQuest, who is the funder of our VRT Road Tour sessions. Highlighting also that the work AIDPH has done with CareQuest, before 2021, there really was not a lot of veteran oral health data, which is what AIDPH is aiming to close the gap on. We use a community engaged manner, conducting research to provide briefs and advocate with informed data based on accurate research to present to our communities. And then what does veteran oral health look like nationally? We're going to dive into that first before getting into Nebraska statistics. Let's start with a national overview that this might be familiar for some, but we found that many people, even veterans themselves, aren't fully aware of how VA medical and dental benefits actually work. Doing this work for many years, we have repeatedly found that many people don't understand the eligibility process, what care veterans are able to receive, or even where and how they can access that care. And that's why we like to begin by setting the stage with a clear picture of what's currently available through the VA and what veteran oral health looks like at a national level. And the main point is that eligibility for medical and dental care through the VA isn't set by the VA itself. It's determined by Congress through a federal law called Title 38. That law outlines what care is covered, who qualifies, how much it costs, and where it can be delivered. Because of that, any major change, like expanding dental coverage, requires congressional action. It's not just a policy update. It involves passing new legislation and securing federal funding to support it. So when we talk about the limitations and access to dental care for veterans through the VA, it all ties back to laws at the federal level. However, I also want to point out that that doesn't mean we can't take action and impact change at the local and state level. It takes getting educated like we are doing here today and collaborations with our local communities to create that change. And you'll see a diagram here. It's mainly to highlight how many veterans are not receiving care currently in our country. Most veterans are not eligible for dental care through the VA. That top row of people you see represents all 18 million veterans living in the US today. The lighter color shows the veterans who receive care outside the VA or aren't eligible for VA healthcare at all. As you move to the left of the chart, the darker blue section represents the nearly 9 million veterans enrolled in VA healthcare. But of those, only a tiny fraction, which if you look to the very far left, the small blue and red segment is actually eligible for dental care through the VA. What that means in practice is this: veterans might go to the VA for a medical appointment, get treatment for a chronic condition, but leave still dealing with untreated dental pain because they're not eligible for dental care. Additionally, even among the 1.8 million veterans who are eligible for dental benefits, only about a third actually use them. Barriers to care and lack of awareness play a big role. So we're left with a deeply inequitable system. Veterans either aren't eligible at all or face a fragmented oral health landscape that makes it hard to get consistent, high-quality care. And we know this problem is even worse for veterans living with chronic conditions, where good oral health is especially critical with multiple systemic diseases. And as we look in chronic disease and veterans living with chronic conditions like heart disease and diabetes are especially vulnerable to oral health issues. What's even more concerning is that the veterans with these high-risk, high-cost conditions are more likely to lose all of their permanent teeth. And we see poorer health outcomes for veterans than non-veterans, even if they've seen a dentist in the past year. So access alone isn't solving the problem. Even when veterans are getting dental care, many still face some of the worst oral health conditions. A big reason for that is the lack of integrated care. These chronic conditions aren't being addressed in coordination with oral health needs. That's why this issue can be so frustrating. The VA is the largest integrated healthcare system in the country. It's uniquely positioned to manage complex care for veterans with multiple chronic conditions. But since most veterans aren't eligible for their dental care through the VA, they're missing out on that critical coordinated care, leaving major gaps in their overall health outcomes. And this is just some data on systemic health conditions that we know affect oral health. This is the most recent research from AIDPH conducted in partnership with CareQuest that really focuses on the connection between chronic disease and oral health. Even after controlling for factors like income, education, and whether someone lives in a rural area, we found that veterans with diabetes were still 40% more likely to be edentulous, meaning that they would lose all their natural teeth, compared to veterans without diabetes. That's a powerful indicator of just how strong chronic disease can impact oral health outcomes, even when other risk factors are taken into account. And just as concerning as diabetes are the findings related to heart disease. Veterans with heart disease were 30% more likely to completely be edentulous compared to those without heart disease. This reinforces what we're seeing across the board. Chronic conditions like heart disease and diabetes have a significant impact on oral health outcomes for veterans, even beyond other contributing factors. And as most of us know in the dental field, prevention saves money. What we really want to highlight here is that this isn't just about poor oral health outcomes or reduced quality of life, though those are serious concerns. It's also about the broader health impact and the cost of care. When dental care is managed as part of an integrated healthcare system, like what the VA could offer if dental coverage were expanded, there's a clear opportunity for cost savings, especially for veterans with chronic conditions. Some of our recent research shows that for every $1 invested in dental care as part of diabetes management, there's a $1 savings in related medical costs. And with heart disease, it's even more striking. Every $1 spent on preventative oral health care can result in $2 saved in heart disease management. So at that point, dental care isn't just a health benefit, it's actually paying for itself. That's important context to keep in mind as we look at chronic disease trends in Nebraska and consider what solutions might look like there. And this is just a community spotlight on rural veterans. These are data points collected through research from AIDPH and CareQuest Institute. They come from BERFIS, which is a national survey of veterans that we collected that was administered in 2021. And from data accessed through the VA. And this is just basically showcasing urban versus rural veteran piece that we can see that 49% did not qualify for dental care through the VA compared to the 29% of urban veterans. So we can definitely see that gap in care there. And at AIDPH, it is important for us to also look at the personal impacts of what the data is showing us. This is a quote from a working age veteran living in Maryland that we talked to during our collection of data, asking for help because they do not qualify for a VA dentist. So they're in pain, they know they have dental concerns, but they are not able to get those addressed. This is our veteran oral health dashboard. And Rahel, if you could just go ahead and pop vet dental data into the chat there so you guys can follow along if you'd like. This is just a more interactive insight on rural veterans, cost of care, state-based indicators that can be accessed through our website, vetdentaldata.org. We have an entire tab dedicated to rural veterans. While the data isn't available from MEPS, which is the Medical Expenditure Panel Survey on a state level, they can be evaluated by region on our dashboard. So it kind of gives a proxy of state level data with the dashboard on our website. This is just some more information with oral health problems due to lack of funding or lack of insurance coverage. When you click on the rural tab, it will take you to the interactive dashboard on rural veterans. Across each indicator, it's clear to see that rural veterans delay dental care due to cost, spend more out of pocket on dental care, and struggle to find accessible locations for dental care. This is all veterans versus rural veteran data on our dashboard. Just a little bit more about our what's available is that rural veterans also feel more impact from lack of access and utilization of dental care, often citing that the state of their mouth or teeth is embarrassing compared to non-rural veterans. Rural veterans also struggle more with functional dentition, which likely leads to the data points we see around increased costs of care and higher emergency department use. Again, all of this research from today is available on AIDPH's website at vetdentaldata.org. What you're seeing here is just a snapshot of the research and tools we've developed to help organizations like yours and across the country access clear, tangible data about veterans. The kind of information can be really tough to find. That's why AIDPH and CareQuest have worked closely with veteran partners and pulled in every available data point we could from the VA, from national surveillance systems, and more. We've brought it all together in one place to make it easier for you to use and apply this information in your work, which is exactly why we're hosting this virtual road tour. And to kick things off, I want to share a little bit about Nebraska and give you some background on why we're doing this road tour. We've developed a set of resources, again, available at vetdentaldata.org, that include research articles, state profiles, and report cards. If you hover over Nebraska on the interactive map, you'll find a detailed profile that outlines what veteran oral health looks like in your state. And I believe Rahel is going to pop in the direct link to the Nebraska on our website, so you can click on that and follow along. These profiles were created for all 50 states to provide specific, relevant information that's easy to access and use. We've also built a veteran oral health data dashboard, which offers interactive, state-specific insights that can be used in grants or policy initiatives. You can explore the data in a way that's meaningful to you and focus on the issues that matter most in your community. So let's begin. To kick things off, as we start to dive into the Nebraska data, we would like you to go back over to Slido and please share in one word naming what you think your state's biggest challenge is for veteran oral health. Again, you can use that QR code, or you can use the link that Rahel provided in the chat to access the platform. Okay, I see access coming through, which is always a very big discussion piece that we get almost from every state that we have been to so far, is that access is a very big challenge for veterans. Okay, and I'm just going to give a few more moments to get a few more votes in.
Hey Shayla, I don't know why, but on your end, I don't think it's refreshing and showing what people have shared. But I could share my screen with you or just read out what folks have typed into the chat, whatever you prefer, and just let you know what's on here.
Oh, that would be
Or
great. Yeah.
Sheila, if you
Oh,
want to press the present button on the top right corner, that can also give you a clean shot too.
perfect. Okay. There we go. Is that better?
Yeah, we can see everything. Thanks, Shayla.
Great, no problem. Thank you. Thank you very much for keeping an eye on that. So we have access to dental care, accessibility, which again is one of the most common responses that we get: cost, benefit information, dental coverage, and then access and integration. So these are all great points to bring up. They definitely come up in most states that we visit. So it's great to capture that's something that Nebraska is also seeing and how we can close those gaps. So feel free, I'm going to leave the poll up, but feel free to keep responding as we continue with our slides. Okay, so what do these oral health profiles look like for Nebraska? We put these state profiles together to answer a simple but frequent question: what does veteran oral health look like in my state? The link to your state profile is in the chat. Feel free to pull it up and follow along, ask any questions in the chat, and think about how this reflects what you're seeing in your own work. The road tour is just as much about listening and learning from you. You know Nebraska best, your data, your context, your communities. Your insights help us improve these profiles and make sure the tools we're providing are actually useful in your efforts to support veteran oral health in your state. We've done our best with the data available, and while it's limited, these profiles aim to offer clear, visual, easy-to-use information that can support conversations and decisions across different audiences. So let's start at the top of the state profile. When we open each profile with some quick context, what's happening in Nebraska and how it fits into the bigger picture nationally, especially when it comes to dental care access through the VA. A key point we always include is most veterans are not eligible for dental care through the VA. That's something many people, especially policymakers, funders, and decision makers, don't realize and are often surprised to hear. So when you're starting a conversation, this is a powerful place to begin. Veterans often don't have another option for dental care. And because of that gap at the federal level, it's states and local healthcare systems that end up carrying the weight, whether it's disease burden, access issues, or care delivery challenges. We've also included data on where veterans live across Nebraska, especially counties with high concentrations. And we pulled in whatever we could find on rural veterans. Veterans are more likely to live in rural areas, and as we know, rural communities already face higher barriers to care and worse health outcomes overall. So right up front, we hope this gives you useful county-level insight to support better informed local decisions about how to deliver care and improve access. And here we take a closer look at the veteran health in Nebraska. We compare Nebraska to national averages because without the context, numbers just won't mean much. So if you're sharing this with a policymaker, a veteran, or a program leader, they might not know if 17% is high, low, or somewhere in between. That's why we included national averages to help you quickly see where Nebraska stands. You can also compare across states if that's helpful. Some states have similar challenges or demographics, and as someone working in Nebraska, you probably know which comparisons make the most sense. All 50 state profiles are available on our website if you want to explore further. Earlier, I mentioned chronic disease, those high-cost, high-risk conditions like heart disease and diabetes that are closely connected to oral health. Because those connections came through strongly in our research, we wanted to make it easy for you to highlight them when you are talking with decision makers or planning programs. So in this section, you'll find data on heart disease, diabetes, insurance status, and edentialism, all compared to national figures. We also ranked each state across those 4 key outcomes, so you'll see where Nebraska falls compared to all 50 states. And just a heads up when you are looking at this, number 1 means the worst outcome. And so the higher the number, the better. If you're interested in how we did the rankings or want to dive into the technical details, the full methodology is posted with the profiles on our website. Okay, and just looking a little closer at some of the systemic diseases and the overall grade for Nebraska, we get the grade portion of the profile. So we see the grades individually given for diabetes, heart disease, uninsured, and dental visits. The percentage of veterans in Nebraska that have visited the dentist in the past year, and those combined for an overall grade. What I want to point out with this portion is to encourage you not to only look at the areas where there is a lower grade and an obvious call for improvement, but to also look at those areas of higher grades and success as well. Taking a look at where your state is succeeding and exploring the why and how you got there with that aspect of veteran oral health care can give us a lot of insight to a path forward for the areas where we need to improve. We can take strategies that lead to success in one area and potentially apply them to the next area for improvement. Additionally, you can use that tactic when looking at other states, looking at your neighbors or states who you may have a similar environment with, whether that be veteran population numbers, government structure, or healthcare infrastructure, can be a helpful tool in finding successful models and strategies to pursue for your state. And then this is just a screenshot from vetdental.data.org. The dashboard allows you to quickly gain insights on key indicators, comparing other states to the oral health status of veterans in your state. And this tool can also be helpful for decision makers who want to gain insights into their state and surrounding states when it comes to improving veteran oral health. And this will give you the opportunity to quickly gather comparable data. It's easy, fast visual comparisons of your state and others in regards to those veteran dental indicators. And so in the chat, if you could just answer this one discussion question: what is one barrier that isn't in the data, but you know is real for veterans in your community? And you can also feel free to come off mute if you want to just have a statement or question in the chat, whatever's most comfortable for you. Okay, I'm seeing transportation to facilities, which again, we see that on almost all of our veteran oral health road tours, especially in rural areas. That can be such a barrier to care. I'm seeing a lot of people agreeing with that. Yeah, that's definitely something that is an issue. Not a lot of providers accept Medicaid, also a very, very common issue we see on the road tour. Understanding benefits and enrollment. That's another we see that a lot. Veterans just aren't even, they don't know what's out there. So how do we close that gap in those educational resources or informing veterans of what they are eligible for and where to go for it? Tech access and barriers. Yes, especially those last few years, dental care, tech it can be very overwhelming for a lot of people, but that's where the community is going, is more tech savvy for sure. Wonderful. Those are all great responses. Thank you for sharing. I'm going to go ahead and go ahead with the slides, but feel free to keep popping anything in the chat. And Rahel, you can just interrupt me if there's anything else we need to address. Okay, using your state profile. Going through those details was informative, but what we really want you to take away from this session is next steps in how you can leverage this as a tool in your work. We want to use the data to illustrate need, share the profile and start conversations, and take action and elevate success stories. So with veteran advocacy, advocating for policy, social, and clinical changes that improve access, decision-making, inform your own work, determine next steps, create strategic directions. That could be for grants, summary reports, legislative change, anything like that that could help improve veteran oral health access in your state. One of the most powerful things we can do with this data is to advocate. That can look different depending on your role. Maybe you're a provider, a policymaker, or a veteran yourself. This profile gives you credible local data to bring to city councils, state legislators, or your congressional reps. You can also organize a listening session in your community and invite decision makers to hear veterans speak for themselves. And remember, small advocacy actions like calling an elected official or submitting a public comment can ripple outward in big ways. So just speaking up for veteran oral health is one of the most empowering things we can do. And then looking at education, many people working in healthcare or veteran services don't know how stark the oral health gap is. That's where education comes in. You can use this profile to lead a short talk at your organization's staff meeting or to brief a coalition or partner. When stakeholders are informed, they become allies, and that's how we build momentum. This is also an opportunity to collaborate across silos. Maybe you bring this to someone in housing or mental health or food access and find a new way to align your efforts. All to say, this data is a great tool for strategic thinking and informing strategic decisions. Whether you're leading a nonprofit, managing a health program, or advising on policy, you can use this profile to help decide where to focus. Maybe there's a rural county with no dental providers or a population group at higher risk. This also helps make the case for why you're investing resources where you are. And if you're doing evaluation or reporting, it gives a baseline. Here's where we started, and here's what we're going to try to shift and accomplish. And then fuel reports and grant applications. How can you bring in resources? Grant makers and funders want to see data, and they want to see it grounded in the community. This profile gives you that. You can use it in the problem statement of your grant or to show gaps in care. You can also cite it as a foundation or for what your solution will address, and as a benchmark if you are measuring outcomes and deliverables of a program. Okay. And then for discussion, and I think Rahel is going to also pop this into the chat, which of these 4 uses for the state profile, advocacy, educating, stakeholders, decision-making, or grants, feels most relevant to your role and or organization? And feel free to come off mute if you would like to vocalize that, or feel free to put it in the chat as well.
Shayla, I want to prompt a question to the group if I can. In the vein of this discussion, I saw folks highlight a lot of barriers, especially ones that we haven't been able to capture in the data, because obviously you know your state and your populations best. I'm curious how anyone might want to chime in on using these data to perhaps address some of these barriers. Do you feel like it's actionable to do that? And even how you might prioritize the advocacy or the education or decision making, some of these pieces and addressing those barriers. If anyone would like to come off of mute and comment on that, I'd love to hear more.
Hi, this is Joey. I can share a little bit about just why I love this dashboard, and I think it's so helpful. Preparing for the upcoming legislative session, we are, currently reaching out to our state senators and getting meetings scheduled with them because we are obviously expecting a really interesting session with a lot going on. So to have some of this data prepared for us, it's a really great fact sheet. It's easy to present. It's something that you can print and leave with the legislators. For me personally, that's how I plan to use this.
That's wonderful. Thank you so much for sharing, Joey. And that's the whole point of this, is just how to help states get the information needed to help make change within their communities. I'm seeing a lot of education responses in the chat too, so.
And I would just encourage anyone to also reach out to our Nebraska State Department of Veterans Affairs. They have a lot of wonderful data, and they are the leading partner of our Vet Mom event we hold. We've had 3 of them now. It's an annual event that we hold for our veterans, their spouses, and surviving spouses in the state to provide free dental care. We realize that's just a kind of a drop in the bucket. But I do want people to realize there are activities taking place to address veterans oral care in Nebraska. And I know that our State Department of Veterans Affairs has a lot of great Nebraska specific data. So please reach out to them as a resource.
Jessica, I'm wondering if you might consider, is there a website or a landing page that we could highlight that activity? I'm sure Shayla, will talk about this too, but we capture all success stories or program models that we can put into our summary. And I would love to be able to capture that if we can pop that into the chat, make sure we link to it.
Yeah, I will get a link for you.
Thank you so much, Jessica. Okay, a lot of great discussion. I'm going to jump back to the slides. I believe we are going to go back to Slido one more time here. Yes, so if we can go back to Slido, if anyone needs the link, it is in the chat, or you can just use that QR code. And we would just like to hear from you on which of the following resources would you use most in your work with veteran oral health? And just give a few moments for everyone to respond there. Seeing the main one is the education materials, which is usually the highest one in as we've been going through the road tour here for most states. And just to also highlight that the education materials, policy brief, research finding can all be found on our website to help you accumulate data, research findings, education materials for any programming that you may have. So always, as always, you can visit vetdentaldata.org for those resources. All right, and just moving on, we always like to highlight or give an advocacy spotlight to these 3 states on the road tour. Florida passed legislation creating the veteran, hold on one second, I'm going to toggle back to my slides here, I apologize. There we go. Florida has passed legislation creating the Veterans Dental Care Grant Program within the Florida Department of Veteran Affairs. This program is designed to provide dental care to veterans living in Florida. The department will partner with a statewide direct support organization to administer the program. That organization will distribute grants to nonprofits with a strong track record of serving veterans. These nonprofits will deliver care to eligible veterans based on income, service history, and other qualifying criteria. This new legislation is just being implemented now, so we should keep an eye on Florida and see how it is working. It's a really innovative approach and exciting to see it come together in the future. Another state is Oregon, which has developed an innovative Medicaid carve-out specifically for veterans who don't qualify for VA dental benefits or traditional Medicaid. Veterans are first screened to determine if they qualify for either. If not, they're enrolled in a local coordinated care organization and receive free dental care through a network of community clinics participating in the program. And lastly, Iowa. It's a state that uses lottery dollars to fund the Veterans Trust Fund. This fund provides direct grants to veterans to help cover out-of-pocket health expenses, including dental care. And looking at veteran oral health in Iowa, AIDPH has done a lot of research with the state of in the state of Iowa on veteran oral health, and a deeper dive focusing on research with the Delta Dental of Iowa Foundation, and they performed a thorough analysis in the state of Iowa to create actionable recommendations in order to speak with stakeholders and promote collaboration. We have also published summary reports as well to utilize and take action on advocacy and implementing these strategies with these reports. And this is all, again, available on our website. Also, just strategic recommendations to stakeholders in Iowa that can improve the oral health and well-being of veterans by investing in strategic opportunities to improve access and quality of care. Again, all of this data is on our website. Alrighty, and with that, I am just going to stop screen sharing for a moment and just invite anyone that has any questions or would just like to make a statement or have anything that they would like to add to our road tour to please come off mute or add in the chat now.
I just wanted to say thanks, Shayla, to you and your team for putting this on this afternoon. Dental care across rural Nebraska is something that remains challenging, and then when we add on veteran dental care and veteran access, even more so. And so, really appreciate the work that you guys are doing, the advocacy that you're doing, and hats off to you.
Thank you very much. It's been a pleasure for me to work at AIDPH. Like I mentioned in the beginning of the session, I was a hygienist for about 15 years before I started to kind of say, I kind of want to do more. I was just seeing these gaps in care and not understanding it myself. And I'll be honest, I really didn't understand. I think, oh, I know so much about dentistry. I've been in all of the facets for almost 2 decades. And then I get into the public health realm, the legislative, the policy making. It's so different. I was honestly thought I was so prepared. And then I started and I'm looking at stuff and I'm like, oh my gosh, like there's such a gap, so siloed. And it's just that integrated care is just so needed. So I've been so happy to work at AIDPH and just learn all of these things myself and how we can integrate care and close those gaps.
Yeah. And I see that Jessica posted on the Vet Mom. So the Mission of Mercy. This is the 3rd or 4th year that the VA Nebraska VA has partnered with our local dental colleges and schools and local providers, and some of the early numbers that I've seen come out of there. I mean, I think they did over 450 visits, around 500,000 in free dental care over a 48-hour period just a few weeks ago. So we're looking forward on the rural health side to continuing to or looking how we can better support that and make sure that they can make an even bigger impact next year.
That's fantastic. That's great. And I think Kathleen did share that into the chat, you said?
I believe Jessica did.
Oh, Jessica did. Okay. Thank you so much. Yeah, we will capture that and definitely include that. So thank you so much for sharing. Any other questions or discussion points that anyone else would maybe like to post in the chat or come off mute? Okay, I'm going to move forward with the slides, but feel free to post anything in the chat or come off mute at any time. Let me just share my screen back here. Alrighty, so a call to action. We hope that you are feeling activated, but I also know this is a lot of information to take in and we are all busy. So I want to leave you with one concrete, easy step to take after this session to keep momentum. Share the state profile with one person or organization. And if you are willing to post in the chat who you are going to share that with, we would love to see that. Let's keep each other engaged and encouraged to advocate for veteran oral health. Alrighty, and then just some next steps, which Rahel is going to post these links in the chat for us. CEUs are available for today's session. They are hosted on our AIDPH Academy and can be located via the link in the chat. There will also be an email in the coming days with all of this information as well if you're unable to capture it right now. Recordings and resources from today's session will be available on the AIDPH website and the Academy. And we are also have an initiative where we are doing veteran storytelling. Rahel is going to post that link in the chat. So we want to gather stories from veterans in your state using our storytelling form, or maybe a story that you have. Feel free to share that form or fill it out yourself. We would love to hear those stories. And you can find all the links, of course, today as well on vetdentaldata.org. We also wanted to spotlight our Veteran Oral Health Week that's coming up. It is November 10th to 14th. We invite you to join us on this initiative. We will have different daily topics, including the landscape of veteran oral health, building the evidence for veteran oral health, access to care for veterans. And you can partner with us in this campaign to promote resources, highlight disparities, and create calls to action for our veterans. Just fill out the form to participate using the QR code on the screen, or there will also be the website link dropped into the chat. Alrighty, and this is the summary that I was talking about before. We want to call attention to our newly released report for our Veteran Oral Health Road Tour Stops. This report reviews successes, challenges, and promising practices we've learned so far in all of the states we virtually traveled to, and we will continue to update this document with new summaries as we expand this tour. We'll let you know when your state has been added, but until then, check out what our partners are doing in each state to improve veteran oral health through policy, community, advocacy, and clinical care. And Rahel is also going to just pop that link in the chat directly to the summary report. Alrighty, and I just want to thank everyone for participating in this discussion. We were able to capture some great data that we can move forward and include into the summary report as well. I just wanted to give one more chance. If anyone wanted to come off camera, or if there were any final thoughts, please feel free to do so now. Alrighty. Well, everyone have a great day. Any follow-up emails or questions, please feel free to email us and we will get a follow-up email out shortly in the coming days. Have a great day.